So good afternoon, everyone. My name is Professor Dan Lubman. It's my great privilege to be the director of the Turning Point and the Monash Addiction Research Centre. Thank you for joining us today for this very important launch. Before we begin, I just want to acknowledge the traditional owners of the land on which we meet and pay my respects to elders past and present. And I extend that respect to all Aboriginal and Torres Strait Islander people here today. At Turning Point and Mark, we recognise the continuing impacts of colonisation, including dispossession, trauma, racism, and exclusion, and how these intersect with these experiences of addiction. We are committed to listening, learning, and walking alongside Aboriginal and Torres Strait Islander communities in ways that honour cultural knowledge, healing, and self-determination. I also want to acknowledge the incredible courage and leadership of people with lived and living experience of addiction and dependence. Your insights and advocacy have shaped this guide and continue to shape the future of our sector. Through your voices, lives are saved, systems are improved, and stigma is challenged. Thank you. We're here today to launch Framing Addiction and Dependence, Building Support and Reducing Stigma. This guide is for all of us, clinicians, policymakers, advocates, researchers, media, and people with lived experience who are working to shift the conversation around addiction. We're thrilled to be joined by Mark Chenery, co-author of the guide and co-founder of Common Cause Australia. Mark is a national leader in values-based communication, and today he'll walk us through how we can use framing to shift attitudes, build empathy, and inspire change. This guide was commissioned as part of the Rethink Addiction campaign, a movement of over 80 organisations working together for a more compassionate and coordinated response to addiction. Along the way, we faced a really important question. How do we talk about addiction in a way that unites rather than divides? The word addiction itself sparked real debate. Some of our advocates saw it as essential, others worried it carried stigma. That's why we needed evidence about how people perceive these terms and what messages actually shift public attitudes. At the same time, we know the stakes remain high. Addiction is one of the leading causes of preventable death and disease in Australia, yet treatment is chronically underfunded, services are stretched, and stigma keeps people from seeking help or receiving it. We partnered with Common Cause Australia to undertake a national study with over 2,500 Australians, combining discourse analysis, message testing, and stakeholder consultation. The result is this guide, a practical tool that shows how we can talk about addiction and dependence in ways that build understanding, reduce judgment, and drive support for change. We're launching this guide in the lead up to International Overdose Awareness Day, which is on August the 31st. A day to remember those lost to overdose, support grieving families and friends, and recommit to ending preventable deaths. Stigma is not just an issue of language, it is a fundamental barrier to necessary healthcare, and too often it's a matter of life and death. It's my great pleasure to hand over to Mark Chenery on that note, who will take us through the research, the insights, and how can we all start changing the conversation and change lives. Please join me in welcoming Mark.
Brilliant. Thank you, Dan, and good afternoon, everyone. I am Mark Chenery. I'm the co-founder and director of Common Cause Australia, and together with my colleague Kate May, led this research project with Turning Point. So what I want to do today is introduce you to the research that we conducted and some of the key top tips that emerged from that process. But before I go on, I should probably tell you a little bit about our particular approach to communications, because it sometimes is a little bit different to what people might have heard of or used themselves before. The first thing to point out is that we take a values-based messaging approach, which means that we acknowledge that as human beings, we are far more driven by subconscious processes and biases and values and cognitive frames, and these influence how we feel about the different options before us when it comes to issues like addiction and dependence, far more than we are influenced by logical, conscious processes of weighing up the facts and figures about what's right and what's wrong. So in our research, we are very, very focused on understanding what these subconscious drivers of people's behaviors and attitudes and beliefs are. And one of the things that it will influence how people feel about issues is the perspective that they're taking on any issue in any moment. So what you're looking at here is a visual illusion called the duck rabbit. And as you look at this image over time, you'll be able to see probably both a duck and a rabbit, or maybe some other kind of bird other than a duck. And this is a visual illusion which illustrates quite an important concept in cognitive framing, which is one of the key disciplines that underpins our approach. And it's biconceptualism. So the ability of the human brain to perceive the exact same thing from multiple different perspectives. And it's an incredibly revolutionary concept actually in communications when you realize the full implications of it. Because there's a very common piece of advice that communication experts dole out, that you might have even given others yourself, and that is that we have to meet our audience where they're at. Now, that's good advice when it comes to understanding our audience so we can better relate to them. I fully endorse that. But it's also hugely misleading advice if we take it to mean that there is a fixed place where our audience is at where we must meet them. Because the reality is that most people can see most issues from multiple different perspectives, just like they can see the duck and the rabbit here. They can understand addiction and dependence from multiple different perspectives. And depending on the perspective that they are thinking about that issue from in that moment, they can actually arrive at very different conclusions about what's right and wrong and how do we respond and what's the right way to behave here, because it makes them feel differently at a gut level about the issue. And what we have found in our work, and what we always do in our research, is we will always split audiences into 3 different groups based on their levels of biconceptualism. So we call these attitudinal groups. On the one hand, you're going to have supporters. These are people who agree with you. They agree with you about the problem. They agree with you about the solution. And what makes them unique in our segmentation approach is that they are not particularly biconceptual on this topic. So on this particular topic, they are with us and they are so fixed in their perspective that they actually struggle to see it from an alternative perspective. And that's really good news for us because it means that our supporters are with us and we're not going to lose them. But unfortunately out there in the community, there are going to be people who we call the opposition. They are people who disagree with us about the problem and what causes it. And as a result of that, they do not support our solutions. And in fact, when we talk about the sort of solutions we think are needed, it makes our opposition feel at a subconscious level, a negative emotional reaction. And so they are just as fixed in their perspective as our supporters are, and we've got very little chance of moving them. But the good news is that in between these polar opposites, we've got a whole bunch of persuadable people out there who, by our definition, are people who are biconceptual. They can see the issue from a supporter perspective when we frame our issue well, but unfortunately, they can also see the issue from that opposition perspective. And if we're not careful in how we frame our issues, we do risk activating an opposition perspective in persuadables. So that's what we've done in our research. We have focused in on those persuadables and what is it that we must say and do to activate helpful perspectives in them. So in our particular research for this project, that arrived at the message guide that we're launching today, which you're looking at there, it was about a year-long process. The first stage of our research involved scoping. So that was a review of existing research in this area to understand what existed in terms of looking at people's attitudes to addiction and dependence and how they understood these things. Also looking at any message testing that had been conducted to find out how to toggle people into helpful frames of mind and build support for what we want. We also then conducted a frames analysis to look at, okay, what are the different perspectives that Australians hold on this issue? We interviewed a number of advocates coming from a range of different perspectives, but all agreeing with one fundamental point, and that is that we want to address the stigma that people experience who are experiencing addiction and dependence. And then finally, we did a public discourse analysis to understand how the public thinks and talks about this in public sources such as in the media, in politics, in social media, popular entertainment, and also how advocates are framing this issue in the public domain. So we trawled through tens of thousands of words of discourse and coded thousands of words of discourse from over 150 different sources. Then from there, we had strong hypotheses as to what might be helpful perspectives and what might be unhelpful perspectives on the topic. And we put that to the test through dial testing. So dial testing is an online survey of a nationally representative group of people. In this case, over 2,400 Australians, nationally represented by age, gender, and location. And we asked them all sorts of different questions, from agree, disagree questions to forced choice questions, where we frame the issue from what we think might be a helpful perspective, but we put that up against what we think is an unhelpful opposition perspective. And then we see what in the real world will persuadable people do, which perspective sounds most right to them. To see that in the real world, can our narrative actually beat the unhelpful stigmatizing narrative? We also did split sample testing, where we do sort of A/B testing. We split the audience into two different groups and then frame the issue a little bit differently, or perhaps use even just a single word that's different to each group to see whether that changes responses. And then finally, we did the dials. So dials are audio recorded messages, which are about 30 seconds long. And as people are listening to the recorded messages on their computer or on their phone at home, they can move a dial on their screen up and down to indicate how much they agree with what is being said in each moment of the message. And the end result is a word-by-word analysis of what's working and what's not in our messaging. And I've got a couple of those dials to show you a little later. So from there, we then split our respondents to that survey into our attitudinal groups, into our base, into our supporters, our opposition, and our persuadables. And then we paid particular attention to what are the words, phrases, and messages that toggle that persuadable audience to answer the questions like our supporters, and when do they do the opposite? Because that gives us a sense of whether we're toggling them into helpful or unhelpful frames of mind. We then shared those insights with our external reference group, and then with their guidance, pull together the message guide that we're launching today. So what I want to do is now tell you what we found in our research and share with you some of the tips. So like I said, in the end, we surveyed just over 2,400 Australians. And what we found is we've got roughly 19% of the population who are our supporters. So these are people who agree with us. They agree that, and they agree very strongly, that people should have access to the treatment and support that they need and want, and they should get that treatment and support without judgment or shame. Our opponents represent about 12% of the population, and they are on the other side of that. So they judge people who experience addiction and dependence, and they also do not support sort of policy solutions and the funding that is required to provide a proper health response. And then 69% of the population are persuadable. Now, overall, persuadables tend to agree with our supporters, but they are also very vulnerable to that opposition framing. So when we put opposition messages in front of them, many of those persuadable people are persuaded and will agree with those opposition sentiments. So they will flip-flop around between helpful and unhelpful ways of thinking about this issue. The good news is that we can influence people when it comes to this. And what we did in our survey is, prior to hearing our dial messages, we asked people all sorts of different questions. And then we repeated some of those questions after they heard the dial messages to see whether we'd managed to shift anyone's attitudes on the topic. And what we found is a lot of positive movement, some of which are, we saw an 8% increase in the number of Australians who agreed that communities need to provide better support to people experiencing addiction and dependence, a 14% increase in the number of Australians who support government action to improve treatment and early intervention, and really encouragingly, a 13% reduction in the number of Australians expressing stigmatizing beliefs about people experiencing addiction or dependence. So that's really, really positive changes in attitudes through the course of the 15-minute survey. And it gives me a lot of hope that if we can embed this helpful framing that we've uncovered into our day-to-day communications in the community, that we can actually have hopefully an even bigger impact. So now I'm going to share with you just 4 top tips from the message guide. The message guide has more tips and it goes into them in more detail. So I do encourage you to download it and have a read once we've done here. But I'm going to just share 4 tips that I think are to give you a bit of a taster for what's included and I think are particularly important. So as Dan mentioned, there's mixed reactions from advocates as to the term addiction and whether it's appropriate. So there's a bunch of advocates who feel that addiction is a triggering word for them personally, who also feel that it might be stigmatizing in the community when used in our public communications. And there are others who are very much in a different position, who see addiction as a word that they identify with through their personal lived experience, or who see addiction as a term which is the only appropriate term to be used to describe the full various forms of addiction, from alcohol and drugs through to things like gambling. And so we've got very mixed reactions to this term, and we wanted to spend a lot of our time and effort on unpicking this and identifying to what extent and in what ways using the term addiction might have problematic outcomes. And we spent about a third of our survey exploring this. The first third of the survey, we split audiences into 3 different groups, A, B, and C. Group A received messages around that referred to the word addiction in questions. Group B only received messages that included the term dependence. And Group C received saw no messages with addiction or dependence, but instead only descriptive terminology. And so what we found in the end is that we could not identify any statistically significant difference in how audiences were responding based on the terminology. In other words, the wording didn't make a difference for the most part. It did not change how people perceived the problem or who they blamed for it. It didn't change how they perceived the solution and their support for things like policy change or funding, or who should get support and who shouldn't. That didn't change. We also, really importantly, didn't see any change in levels of stigma that people applied or directed towards people experiencing addiction and dependence. So in other words, we searched for differences and couldn't find them. And so based on that, I would say that there is no evidence to suggest that the term addiction or dependence is preferable or worse, but we still know that people have strong opinions around this. And so our guidance in the message guide is to make your own call about whether to refer to addiction or dependence, basing it on what you feel personally comfortable with, but also what you think is appropriate for your audience. And that's going to be made on a case-by-case basis. But I suppose the biggest message I have for you today on this tip is we spend a lot of time and effort debating single words like this, and they don't make a huge difference to public support or stigma. And instead, we should probably be spending more of our time focusing on other framing elements, which is what are the tips that we're going to turn on now. First tip is to externalize the problem. So we know that a dominant frame for addiction and dependence is that it's caused by poor choices and a lack of willpower. And therefore the harms associated with it are the sole responsibility of those experiencing it. Now, this is obviously a way of thinking about the topic that frames and fuels moral judgment. And it also overlooks systemic factors and causes, and therefore doesn't build support for those systemic changes that we need. So it's deeply problematic. But thankfully, while the opposition holds this perspective very strongly, and while the persuadables also are attracted to this way of thinking, it is possible to toggle persuadables into a different frame of mind if we very intentionally, when talking about the problem, frame it in terms of the external barriers and harms that people face. So things like stigma, things like criminalisation, or lack of funding for research and healthcare, focusing on these external barriers and harms all helps toggle persuadable people out of that stigmatizing way of thinking about the problem. And so in your messaging, I strongly encourage you to make sure that you are focusing on these external barriers and harms as a way of pulling people in the right direction on this. One of the harms that we found was most effective, or the most powerful barriers to highlight, was that of stigma. And I'm going to show you a dial message in a moment that speaks to that and shows you what that looks like in practice. Thirdly, we know that one of the ways in which persuadable people think about this topic, when they're thinking about what are the principles at stake here in terms of how we should respond, one of the deeply unhelpful but also dominant frames that they use to think about this is personal accountability and the importance of holding people accountable for the choices they make. And obviously, when people are thinking about addiction and dependence from that perspective, that leads to increased stigma and reduced support for policy change and funding for treatment and support services. But thankfully, if we instead get people to focus on the external solutions and support that can be provided and the positive impact of them, we can actually, again, shift persuadable people into a more helpful frame of mind. In fact, we found throughout our survey that whenever we mention treatment or support in our messaging, it had a really strong positive impact on attitudes and policy support. And in fact, when we asked people or put sort of forced choice questions in front of people where they had to either choose a statement which was effectively stigmatizing and about individual accountability versus a statement that was around the importance of everyone having access to healthcare and treatment and support when they need and want it, the latter statement won. In other words, for most persuadable people, they're more attracted to the idea of supporting people with treatment and support rather than the idea of holding people accountable for choices that they've made, which is excellent. Now, my fourth and final tip that I want to share today is a bit of a word of caution, really, and that is that we know from previous research, so research we did, which you'll find on our website, which is called Drug Stigma Message Guide, that the majority or a dominant frame that Australians have for drugs and illicit drugs in particular is that they are inherently addictive and harmful. And they believe that the majority of people who use illicit drugs will become addicted and it will have significant negative impacts on their life. But we know that's not true. We know that the majority of people who use illicit drugs do not experience addiction or dependence. And we also know that the majority of harms that people experience from drug use is not from addiction, it's from external sources of harm, including criminalisation and stigma. And one thing that we can do to avoid accidentally pandering to that dominant frame that addiction is an inevitable outcome of drug use is to explicitly point out when we are talking about addiction that it is not something that everyone who uses drugs will experience. But for those who do experience it and want and need support, we should absolutely be there. And the other thing we can do is point out again that the majority of harms that people experience through drug use typically tends to be from things like criminalisation and stigma. So to point out those other harms that aren't about addiction. Because it's really important that we aren't undermining harm reduction in the process of talking about addiction in helpful ways. Now I'm going to show you two of the dials. So these are the audio recorded messages. And what you're about to see is 3 lines on your screen. So as you hear the message being read out, you're going to see how our audience has responded. And you're going to see 1 line for supporters, that's the green line. You'll see an orange line for the persuadables and a red line for the opposition. Now, what we want to see in a good message is we want to see the supporters dialing up. We want them to like the message. If they like the message, they're more likely to repeat the message. We also want to see the persuadables following the same pattern as supporters. So when supporters dial up, we want to see persuadables dial up too. And when supporters dial down, we want to see persuadables dial down too, because it gives us a sense that we've locked them into that helpful frame of mind in which they're responding like a supporter would. And a little bit counterintuitively, we actually want to see the opposition moving in a different direction. We want to see them alienated from the other lines, not because we want to antagonize our opposition in practice, but for research purposes, we know from the rest of our survey that these people disagree with everything that we believe and cannot be convinced. And if they are liking our message, it's a bit of a warning sign that maybe we're not being clear about what we really mean. So a good pattern is kind of seeing that orange and green line moving upwards and the red line moving away at the same time. So let's have a look at 2 of those dial messages that we tested, and I'll say just a few quick words about them once we're done.
We all deserve to be treated with care, respect, and dignity. But when people experiencing addiction seek help, they are often met with stigma in their community from healthcare workers, employers, policymakers, or journalists who rely on simplistic stereotypes, blame people for their pain, or simply turn away. Over time, people can internalise this stigma, which turns to shame and guilt, making them less likely to reach out for the support and care they deserve. Indeed, it takes Australians experiencing harms from alcohol, other drugs or gambling, on average 18 years to reach out for support. That's why it's important we listen without judgment and meet our friends, family, colleagues and neighbours with the support, connection, love and understanding. We all need to live our best lives.
All right, so three things maybe to point out around that message. Overall, this is an okay message. It is we've clearly got the persuadable audience into a supportive frame of mind. They're responding with a similar pattern, which is good. Where we do lose them a little bit is at the beginning when we start talking about the stigma that people experience in healthcare and media and other settings. We see a little bit of a downward turn for persuadables. We do know from the rest of our survey that most persuadables do actually agree that there is a lot of stigma in the community, so I'm not too concerned about that. Where we see the persuadables start to dial up a little bit is when we then talk about the way in which that stigma is internalized and then prevents access to treatment and support. And then where we see that kind of strong uptick at the end, that is the moment of our message where we start talking about the solution. And remember earlier I said I really encourage you to focus on treatment and focus on support and the positive outcomes that will have. That is what you are doing to people's brains when you are talking about those solutions. They are dialing up, they are agreeing with you, they are liking what you have to say, and they're moving our persuadables closer to thinking like a supporter. So let's have a look at one more message that we tested.
We all deserve.
This one was also a very strong performing message. We know that a lot of us think about addiction and dependence from a health perspective, and one of the questions we wanted to explore in this research is that health perspective helpful or not? It absolutely is helpful, although it's far more about just accepting that it's a health condition and talking about it as if it is, rather than forcing people to agree that addiction and dependence is a health issue explicitly. But we might talk more about that later if we've got time. But let's have a look at this message.
Universal access to healthcare is a core principle of our democracy. We expect our government to ensure that everyone, no matter who they are, where they live, or how much money they have in the bank, has access to the care they need when they need it. But when it comes to the treatment of addiction, our health system is failing. Addiction should be a healthcare priority. Not only is it one of the leading causes of preventable death and disease in Australia, it is also highly treatable, especially if care is provided early. It's time our government provided everyone with the healthcare they need and deserve, and increased funding for research, treatment, and support services for the 1 in 4 of us who will struggle with alcohol, other drugs, or gambling in our lifetimes.
So in this message, we have accepted that it is a health issue. We have started by unifying everyone, including the opponents to some degree, up until about 1/3 of the way through the message, by talking about the importance of universal healthcare and how we should all have access to it, because that's a core principle in Australia. The point that we lose the opposition, which is always going to happen, is where we then introduce the idea of addiction dependence and the importance of providing the healthcare that people need. We see a slight downtick from the persuadables, but from that moment on, they are building throughout our message, which means that the health frame absolutely makes sense to persuadable people, and it's only the opposition that struggles to believe that this is a health issue that should be treated as such. So the health frame, very, very strong, and we've got more to say about that in the message guide. And I might just quickly give you a little bit of a deeper view into our persuadables and what we know about them. So, and our supporters and our opposition. So what we know is that women are twice as likely, or sorry, not twice as likely, much more likely to be our supporters than are men. Men are more likely to be opposers than women. However, have a look at the persuadable line in between. We've got roughly 67 to 71% of people who are persuadable. So vast majority of both men and women are persuadable on this topic. Again, if we look at income, we also see a pattern there with people on lower incomes being more likely to be supporters, and people on higher incomes slightly more likely to be opponents. But again, vast majority of people, regardless of income quintile, more likely to be persuadable. Political orientation, perhaps unsurprisingly, is associated with our attitudinal groups. People who vote the Greens are the most likely to be our supporters, followed by independents and another minor party, sorry. ALP is pretty much on trend with the national average. Pauline Hanson's party kind of been ripped in two by this, with a decent amount of supporters, but also a decent amount of opponents. And the coalition, people who vote for the coalition, are the only ones who are actually more likely to be our opponents than our supporters on this issue. And finally, in terms of people's own experiences with drugs, and including addictive drugs, so tobacco, alcohol, and other drugs that they use daily or weekly, are the most likely to be our supporters and less likely to be our opponents. And people who have, at any point of their lives, even if they haven't experienced addiction, have ever used illicit drugs, are more likely to be our supporters than people who have never touched illicit drugs in their life. And those who have never touched illicit drugs are slightly more likely, actually more likely, twice as likely to be our opponents. So there is something about the experience there and the self-identity that is influencing how people are responding to this issue. And I think I'll just stop there and leave plenty of time for others to chat, and then we'll see what questions you've got.
Thanks, Mark. That was a really great walkthrough of the research and the guide. Just want to say a big thanks to you and a big thanks to Kate, who's the co-author of the guide. A really fantastic resource. And just as you mentioned, just want to big shout out to the advisory group, our extended advisory group. So Mustafa Elkasin from Life as Well, Bronwyn Hendry from Directions Health, Professor Alison Ritter from the University of New South Wales, Claire Davis from Shark, Sione Crawford from Harm Reduction Victoria, Mary Harrod from UR, Shanna Wan from Sober in the Country, and April Long from Smart Recovery. And got April with us today. And April, I just really love, obviously you've always been a long champion of shifting how we talk about this issue. So can you just talk about your reflections on what stood out for you in this work and how you see this guy supporting change in your community?
Yeah, absolutely. Thanks, Dan. Yeah, I've had the great privilege of being involved in this project on the advisory group. And in thinking about sharing with you today, I really reflected on, well, what were my motivations for joining? And obviously at an organisational level, as CEO of Smart Recovery Australia, we work with 90 member organisations. And I know that this is something that we've grappled with as a sector. You know, how do we talk about addiction and dependence, and most importantly, how do we do that in a way to drive change? And if we think about what Mark just presented, the opportunity is that the vast majority, that 69% of persuaders, it's really important, if we're trying to shift the national discourse, how do we bring them on the journey? But also at an individual and personal level, I think, I've struggled with this as somebody with lived experience and living experience of parental and family addiction. How do we have these conversations in our families and in our communities to bring about change? And what I've actually really learnt along the journey is sometimes it's holding our values a little lighter around these things. So I'll share a really practical example with you. At Smart Recovery, we have always talked about addiction as a behaviour. And it's really great in the guide that we talk about that in terms of building empathy. We all do things a little bit more or less than we'd like to. And so, on reflecting on that, I've struggled with the word addiction because of its connotations with addict. And so, we made a decision at Smart Recovery Australia. We removed the word addiction from our entire website. So those familiar with search engine optimization and that kind of process, we took that decision because of that stigma. But what this research really shows us is that, it's really about the power of choice. And the guide says that, it's up to us as advocates and agitators or researchers or clinicians to think about the language we use, but also keep our kind of eye on the prize, which is what are we trying to achieve? And if what we're trying to achieve is reducing that 18 years on average that it takes for people to reach out for support because of the issue of stigma, then we really need to be making sure that we're doing what's most effective to do that. And I think what was really promising throughout this is that, you know, the research shows us that for those that we surveyed, 80% agree that stigma is an issue. And now it's about, well, how do we actually reduce that? And I really liked that, you know, the whole process reaffirmed for us that focusing on those external factors is really important. And I think what that says to us as a sector is that, you know, it's really helpful to look at both the catalyst event and the externalizing factor, like, you know, criminalization, like housing, like homophobia, like racism. If we're not really having those conversations as a sector, we are keeping people in that frame of it's about a moral failing, it's about the individual's personal responsibility. So I think that, again, you know, gives us lots of tools as a sector. Of course, we talk about intersectionality and why that's important in supporting the whole person from a treatment perspective. But in our advocacy with government, you know, in terms of our conversations with media and trying to shift the national discourse and, you know, the hearts and nations of the mind, that's actually really important too. So for us as an organisation, it's about how do we ensure we use more of those case studies in our advocacy, you know, talking about those other external factors that impact people in terms of, you know, supporting them to live their best lives. So it was such a great process to be a part of, to really challenge some of that thinking. As I said, in terms of, I personally have had strong views about the word addiction and how we use it, because of course we don't want to do any more harm. But, you know, what this research shows us is if what we want to do is reduce the time it takes for people to seek help and to reduce that barrier of stigma, then it didn't have any more of an impact. So the last probably reflection I'll finish on is really that focus around harm reduction. You know, I really love that we've got that in the guide, because, you know, we have a tool at Smart Recovery called the cost benefit analysis. And of course there's benefits for, you know, drinking, vaping, gambling. I mean, that's why we participate in these behaviours, but it's about when it causes more costs or harm to the individual and their family and community that we need to support those people. And the majority of people we surveyed supported that. So, you know, I think that's really important as a sector, that we keep that focus on self-determination and, you know, about the individual living their best lives, but keeping the focus on that, you know, the vast majority of people, you know, don't experience harms, and it's about how do we best support them when they do. So, yeah, it was a fantastic process. I think it's going to have huge, you know, implications in the sector, and, you know, it is a real guide that you need to sit with and reflect on, and that's something that we're going to continue to do at Smart Recovery and in partnership with our 90 member organisations.
Thanks so much, April. Thanks for your reflections and your ongoing advocacy. Just if you've got any questions for April, got any questions for Mark, just to remind people, there's a Q&A button at the bottom of the Zoom. So if people have got any questions that we want to ask when we come to the Q&A section, please start putting your questions in there and we can pose those to the panelists. Thanks so much, April, again. I'd just like to sort of also take this opportunity to thank the Turning Point project team. So Professor Shalini Arangiri, Megan Berry, Jonathan Meddings, Jack Bannister, and Ben Vinker, who's manager of our lived experience and advocacy, and very fortunate to have Ben here today as well. You've really helped ensure lived experience was central to this project. So again, can you, your reflections on what does this resource mean to you, and how do you hope it's going to be used across the sector?
Yeah, thanks, Dan, and thanks, Mark, for your presentation, and for Kate for all the work they've done with this guide and the working group and the Turning Point group as well. It's you know, being involved in this process has been great, and I suppose for me, coming from someone with lived experience, it was great to, you know, see that the research shows from people who engage in that research around stigma, and that there is an understanding that stigma does play a big role in people accessing support. So, you know, I find that heartening to know that there are people out there in the community who do understand that. That's first and foremost for me. Another really heartening part of this that I really enjoyed when I first saw these results from Mark was around the persuadables and being introduced to that, and seeing that there was such a large number of people, you know, around 69% of people who were surveyed or involved in the research, having such a significant number, and knowing that there are people out there that we can shift. Because I know I do a lot of advocacy work, and sometimes I get up there and I put myself out there, and I'm wondering, who's this landing with, and is it making a difference? And to be able to see that actually there's quite a lot of people out there that I can have a real impact with, and that other people who engage in advocacy work, you know, we've got a real shot here of being able to move a significant number of people. So that's sort of, I suppose, reignited my enthusiasm for the advocacy work, and going, you know, what we do here can make a lot of difference, and supporting people, shifting public perception, and therefore hopefully being able to reduce that time it takes for people to access treatment and support. Something else from this project and this guide that I found really helped me around my advocacy work was, as I said, like, often I get up there and go, you know, who am I hitting here? But also, what terms should I be using? Like, I know language really matters, it really does, but I'd often wrestle with the term addiction and dependence, and it would occupy so much space in my head around, you know, I want to get the message right. And I would focus so much on these key words. And I think now to be able to park that and put that aside and actually focus more around the messaging, which will certainly help me now moving forward, and hopefully other people who are in a position to be able to advocate for change around. It's this guide, I think, you know, especially at the end of it, around the narrative structures that are there. For me, I find that, like, that real practical help and support really beneficial for how I will go, you know, moving forward with my advocacy work. So, you know, there's a lot in the guide. As April said, like, it's certainly encourage people to take it, read over it, you know, let it percolate for a while, and really sort of inform how you might go about having bigger impact with the advocacy work that you do. So, yeah, really grateful for the guide, for the work that's been put into this. Like, it's, as Mark said, like, it's a big piece of work that's taken a long time. So I'm really appreciative for everyone who got involved with it.
Thanks so much, Ben. I might just invite April and Mark and Ben to stay online, and you know, just to take some of the questions that we got coming through. So thanks for people for sharing the questions. The first question which is a really good question, really for Mark, which is really around how it reflects to other guides that you've put forward in the past. So I know that one of the questions is around the stigma messaging guide that you were instrumental in pulling together sort of 5 years ago now. So maybe you just give some reflections of how your previous work in this space informed this guide, how it complements it, some of the challenges that we had to think through, and sort of what's different or unique around this guide.
Yeah, I saw that question. I thought it was a great one. I would say that it changes nothing. Everything that we did in this research, I felt complemented and did not change any of our findings from previous research. So everything that you see in the drug stigma message guide, I still stand by and think is still valid. And in some ways, we avoided retesting everything that we already had learned from that. But in the things that we did explore similarities, we arrived at the same conclusion at the end. So this is very much not a competing or replacement resource for that. The drug stigma message guide, I'd say, is still absolutely relevant. It is, of course, only related to drugs, and illicit drugs is the focus of that guide. whereas this is about addiction and dependence more broadly in a range of forms beyond just drugs. And this is about the addiction element of that, whereas obviously, as we know, addiction is not the most common experience from drug use. So I think it is about understanding how they sort of the different roles that they play. But I would say some of the things that we found in the drug stigma guide, we didn't spend a lot of time on here, so it's maybe not something that we've emphasized. But one of the things in that guide that I think is absolutely relevant in this case is the importance of not negating. So negating is when we spend a lot of our time saying, this is not true, and that's not true, and this is a myth, and you should stop believing it. Every time we negate, we're actually activating the exact same cognitive frame in people's brains as if we were repeating the myth or repeating the unhelpful idea. And then that strengthens that sort of that neural network in people's brains. And so as a result of that, it's actually strengthening the very myths and unhelpful ideas we're trying to get rid of. Classic example of that is that drugs are a health issue, not a criminal issue, is the thing that we saw a lot in that first piece of research. And in the process of telling people that it's not a criminal issue, we are actually activating that criminal frame. And there's similar kind of things that we did see in the discourse when it comes to addiction. Addiction is not this and it's not that and it's not the other. That's not what we should be doing. What we should be doing is telling people what it is and what we should be doing about it. So start from where you want people to be rather than starting from the place that you want to move people.
Thanks so much, Mark. And I think this relates to another great question from Aaron that he's put up there around sort of the media generally focusing on problems, not solutions. I suppose it just sort of links to your last point. And I don't know if you could say a few things, then maybe throw to April and Ben. But yeah, what you saw in your sort of that initial piece of research around how things are framed generally in this area, which is much more around problems, and sort of any tips or strategies and sort of what we should all adopt moving forward?
Yeah, it's a tricky one, right? Because the media does like a good negative story, but negativity is just, and conflict is just one element of the media narrative. I used to be a journalist myself, and there's lots of sort of what makes something newsworthy, something that is interesting, new stats, something surprising, and conflict doesn't have to be about conflict about the problem. It can be conflict about the solution. And the new research we've just shown that shows just how impactful this solution would be if only the government invested in it, right? So there are lots of ways of finding hooks for the media to give them an excuse to talk about solutions, but we do have to dig out for them. Otherwise, they will just go with the stereotype story that feels familiar to that journalist. And so I think it's not easy. There is work to be done, and there is work to engage with journalists and sort of help them see the importance of the work that we're doing, and also help them think differently about the issue. And I do think that if we kind of really strongly lean into this framing, it does give us a new angle. And that is also something that journalists will tend to sort of stands out to them if they're seeing something that hasn't been said before.
Thanks, Mark. And April, I mean, you do a lot of media. Sort of what are your lessons here for you in this guide in terms of how you speak about the issue when people present lots of problems to you, lots of journalists present all the problems? Sort of what have you learned through this whole process?
Yeah, I think the guide's, really clear in terms of our responsibility as advocates in the sector to really bring case studies that help move that group of persuaders. So I mentioned before about a catalyst event, and sharing those real life stories, whether it's divorce or a car accident, those external factors that are the human nature of our lives. And so, really giving the media a diversity of case studies and stories to talk about these things, because, otherwise, yes, what we see is those stats or, the really negative kind of reporting on those things without the human element that sits behind it, as well as those other external factors that we talked about in terms of, helping people understand, this big thing around, well, what causes addiction, and giving them those diversity of case studies, because I think that's what's really going to get people to be able to relate and get them to see this as a systems failure and not, that individual moral failing. And I think, correct me if I'm wrong, Mark, but I think it was 73% agreed that government should be doing more. So we should be using the media as a tool to, help activate that in terms of sharing those real life stories and getting people to understand and not wasting all of our energy going, is it a health issue, comparing it to asthma and these other things, but going, this is a government responsibility and these are our everyday, family members, neighbours, co-workers that need support. So I think the media is a fantastic tool. We just need to give them the right things to move that group of persuaders.
Thanks so much, April. I think that point of like constantly trying to negate what we're being told is the problem and negate that rather than focus on what the message is that we want to tell is really critically important. I suppose, Ben, just from your point of view, you're starting to do a lot more media now as well. And yeah, again, your reflections around how the guide is sort of making you think about how you respond to those tricky questions and the framing of the problem.
Yeah, I think, like as April said, the media are great in terms of giving us a vehicle to be able to communicate some broader issues. And I think, when we get some of those negative stories or framing coming from certain outlets, and it is an opportunity for us to not negate and to more bring some education to that space. So, like, I see when we see something big and controversial on the front of the paper or hitting headlines, it's an opportunity for us to go, well, I don't need to dive into that, but I know that there's going to be other media outlets that are going to reach out to us now. And how am I going to be able to communicate what I think is important now? And I think lived experience has a big role, an opportunity to play a big role here, to be able to really humanise and be able to attach to those persuadables that are there, that are listening to us and listening to our stories. And I think this message guide is great around being able to really help frame that in a nice, contained manner, so that we can, when the opportunity presents, that we're there ready to go.
Thanks so much, Ben. We've got another great question here from Laura around sort of how do we use this guide to sort of think about some of the policy changes and the support we're looking for. Mark, maybe just in terms of the work we did, you didn't get a chance to present all of it, and a lot of it's in the guide, but do you want to just say some of the other things that, how you're thinking, how we use some of the messaging and framing in the guide to sort of drive some policy changes or support for greater investment, and sort of how the work sort of how that played out in terms of your testing?
Yeah, so we were maybe perhaps unusually broad in what we were trying to achieve in this project. We were mostly, I would say, focused on stigma. That was the primary objective, was understand how do we talk about this in a non-stigmatizing way and how do we reduce that stigma. But we also had, at least one of our eyes on what does this do in terms of policy support? What does this do in terms of support for funding for various initiatives? And we tested various things that might not necessarily, I don't want to say what your policy priority should be. That's definitely not my job. But I would say that we have absolutely explored how people feel about things like criminalisation or decriminalisation, how people feel about extra funding for treatment services, early intervention, better treatment pathways for GPs, campaigns to address community stigma more broadly. And so we've looked at all of that from this perspective. So sort of the advice that we're giving in the guide is what is helpful for all of these things, and what sort of moves the dial on it. Yeah, does that kind of answer the question? I
think so, yeah. And April, sort of from your perspective, sort of obviously you do a lot of work in that policy sort of change space and advocating. So what are your reflections on sort of what the key messages are here and how that sort of supports the work that you're trying to do?
Yeah, look, I think the key thing when it comes to policy or legislative change, or getting governments to take action on issues, is people movements. So if you think about some of the framing, like gay marriage to marriage equality or global warming to climate change, it really took a community, the community, to come along on those issues and to be able to influence. And so I think that's what's most significant about this guide, is it gives us some really clear indicators on how we can move that group, because, you know, we're not going to see the, you know, quality of funding that we need in the AOD sector whilst, you know, politics is a game of numbers, and, you know, there is this, you know, group of opponents and persuaders who aren't really sure where they sit on the issues because of stigma. So I think that's what's most useful about this guide, is helping us to shift, you know, that national discourse and the hearts and minds of the nation, so that when we're sitting at the table with government, we can really show that this is an issue that community cares about. And as I said, you know, it's really clear that people think it's a health issue. They think more should be being done. So I think it gives us a lot to actually influence those conversations if we can continue to bring those persuaders into our supporter group. So yeah, I'm looking forward to using this in my conversations with state and territory and federal government.
And I think we had a question here about how do we get government on side, and I think one of the key things about this message guide, which we'll, or as advocates, will be sharing with government, is this is a good news story for government, because there's a way in which we can frame these issues that is a win for government as well. Because if we got that 70% that Mark talks about of people who have said, well, if we frame the stories in the right way, that's going to be good for all of us. We might have time for just one more question, so thanks for all your questions. Question here from Marianne, Mark, around sort of just, I think April spoke to it before, but just around that issue around if we're trying to explain sort of the underlying sort of drivers of people developing addiction, how do we do it in a way that doesn't sort of paint them in a particular way negatively? And I don't know, Mark, April, Ben, if you had reflections on that.
I'll say something quick, see what April and Ben think. I think probably maybe their perspective is more important than mine here, but I would say one of the things obviously that there's a balance that we are trying to work with, in that pointing to those external causes, things like trauma and stress and anxiety, these external causes of addiction and dependence, is effective at helping people not blame individuals for addiction and dependence, right? So it is helpful, but at the same time, what we don't want to do is create or pander to a stereotype and a sort of something that reduces people's sense of agency, and a negative stereotype of people as broken, like you say. And so what I would say is to blend, when we are talking about these external causes, is to blend a variety of relatable with maybe less relatable experiences that might lead to it, including prolonged stress and anxiety. These are very relatable, hardly exceptional circumstances that people go to, and it is quite helpful. But yeah, I wonder if April or Ben have thoughts on that too.
Any quick comments, April, Ben, before we finish?
Yeah, I mean, I think my reflection is, and I said this before in terms of our responsibility and the systems change and talking about criminalisation and housing and those other things. But I also think, you know, COVID gave us an experience where, you know, we are now more likely to talk about, you know, isolation. You know, Mark talked about prolonged stress, loneliness, you know, combining, and I like that term you used in terms of blending, Mark, in terms of some of those catalyst events, but also, yes, the larger issues like racism, intergenerational trauma, because it needs to be relatable to people and having that real balance. But, you know, I think we are seeing more of these conversations post-COVID, that people, you know, are talking about isolation, loneliness, and the need for connection, and stress and those kinds of things, which is really helpful.
Thanks so much, April. We're going to have to wrap in a second. Ben, any 20-second comment?
Quickly, just that importance. I think April and Mark have lent on that around the humanising the issue. Lived experience is great with that, and finding that common thread or that common ground that people can connect to. So, yeah, I think that's really important.
Thanks so much, Ben. Just a final question from Louise that just says, the impact of personal stories. What is the impact of personal stories told by people with direct experience? I think there's an overwhelming evidence that people telling their their stories has a major impact. And certainly want to thank everyone who tells their story and has the courage to do so. So it's 2 o'clock. We're just going to put up a QR code on the screen. I just want to wrap up. Say a big thank you to Mark and Kate for the great work on the report, to our advisory group, to our internal team, and especially to those with lived in the experience who lead the way. A recording of today's presentation, for people who couldn't make it, will be available on our website later this week. And the full guide that Mark's presented today is available for download today. You can either take a picture of the QR code that takes you directly there. You can go on the Turning Point website and you can access it from there. So thank you everyone for attending today. Thanks everyone for a great presentation, and we'll see you next time. Thanks so much.